Hi, my name is Susan Khalil, and I'm an assistant professor at the Icahn School of Medicine from the Division of Minimally Invasive Gynecologic Surgery. So sexual dysfunction is really a term that encompasses many types of personal distress conditions that result from a problem with desire, arousal, orgasm, or pain. So there's many sexual dysfunction components, but a few common things are really just painful sex, or a loss of interest, or dysfunction anywhere in the sexual response cycle. So sexual dysfunction is actually 43% in American women, with 12% that consider it to be a personal distressing point in their life that they require care for. So there's many causes, but to really group them into two large categories are that they can be related to the life phase that the patient is in, or they can be due to various conditions. So some common phases where this will present include the postpartum period or postmenopausal period, and some conditions that really can present with this type of complaint include endometriosis, as well as sometimes irregular bleeding that presents as an alarming sign, but we can really probe into some other functions and how this impacts sexual health. Right, so the most common onset and peak is usually in middle age, where there will be more complaints about sexual health and sexual dysfunction, and where women will seek more care. Other time points where this can present is with the onset of intercourse, or during the postpartum period or the postmenopausal period, and just with certain conditions such as endometriosis that can cause pelvic pain and sexual dysfunction as well. But the real peak is with the increase in middle age. So sexual health issues at the Mount Sinai Health System are really addressed through a team approach, and we have a vast network of specialists in obstetrics and gynecology, in the Division of Minimally Invasive Gynecologic Surgery, and within other disciplines that can really help support sexual health and well-being for women and for other patients that come to our service. We use the team approach to really try to support medical options that exist, surgical options that exist, as well as alternative-based medical therapies and psychological support during these types of conditions. I think that's such a great question, but we're here to try to change that. And I really appreciate you highlighting this, the awareness about women's sexual health and gynecologic sexual health that's inclusive of everyone that presents for our care. Well, I think if a woman or if anyone else who comes for gynecologic care experiences a sexual dysfunction or concerns with sexual health, I really think that this is something that's important and should be part of the well visit to try to highlight the areas for improvement for medical care, but really coming to the Mount Sinai Health System for gynecologic care, for other services that we can also refer out to or help support during the process. And that can really be through medical interventions, therapy interventions with psychological support, as well as physical therapy, acupuncture, other medications that are newer that are available to us, and really trying to tailor that with a team approach to the individual, and if any surgical interventions are needed as well.